right, welcome back. We've got Mississippi's favorite doctor here, and that's because many people have heard of shingles, and also because 1 in 3 Americans will be affected by shingles at some point in their life. So Dr. Quinn, good morning. Tell us everything, or he's here to tell us everything we need to know about this infection and how we can lower our chance of getting it. Dr. Quinn, what exactly is shingles and what causes it?
Shingles is a reactivation of the chickenpox, the same virus, varicella zoster. When you're a child, if you got chickenpox, which most of us have, as you said, 1 in 3 people will get shingles. It's a reactivation of that same virus that lies dormant in our nervous system. It's usually caused by either stress or decreased immune system, but it also occurs with age where our immune system is decreased, and it can be very, very painful. Usually the person will have a sensation of the skin where it'll be like either tingling, feeling hot, painful, and then 3 to 7 days later, they develop that rash, that characteristic rash that are blisters that are fluid filled, and it usually follows a line or a dermatome of that nerve where it's been reactivated. But the deal is, shingles hurts like crazy. A lot of my patients that come in, they think that they're having a heart attack, like the patient I saw last week where the rash was along his chest where his heart was. But when I looked at the rash, I made the diagnosis of shingles, and I put him on the medication, and he's doing much better.
Well, that's really good news, Dr. Quinn. Also, is this contagious?
It can be contagious in the sense that if you've never had chickenpox, it's the same virus. And if someone touches it, like a child that's never had chickenpox, they can develop chickenpox. But from shingles, you cannot get shingles. Now, there's a lot of confusion out there because the patient that I saw last week, his wife, she Googled and read about it. It's caused by a virus in the herpes family. And she thought that he had herpes, which is, a sexually transmitted disease. And she called the clinic and she was so angry. And I explained to her, it's a whole different group of the family of that particular virus. Like, just say the Quins, we're all a family. Everybody's different in our family. But the deal is, it's not an STD like a lot of people get confused about.
Right, Dr. Quinn. And who is most at risk for shingles?
The people that are the most vulnerable are the old people like myself. So when you turn 50 years old, your vulnerability increases because typically most people that are 50 or older have a weakened immune system. And it's advised to go ahead and get that shingles vaccination, which I got mine after studying so hard. I went ahead and got it on Saturday. But the deal is, if you have an age of 50 or greater or a weakened immune system, say for instance, like last night I spoke with one of my colleagues that's a rheumatologist. He has a lot of his patients on immunomodulators, which decreases their immune system and basically makes it so that they have less pain. They're more vulnerable too. So it's advised for you to get the vaccination as well after talking with your doctor. But if you're 50 or older, as I said, you want to get the vaccination, but you can get it from your pharmacist or your medical doctor. But talk to your doctor or your pharmacist. You have to get 1 vaccine and then 2 to 6 months later get the second vaccine, which I'm surely going to get because I do not want to get that pain. But the good news is the earlier you treat it, the less likely you'll have the post symptoms, which could be post-herpetic neuralgia, which could cause you a lot of pain for years and years. So if you get any suggestion that you have shingles, go see your doctor like my patient right away.
Right.
And if it's a good doctor like myself, we can diagnose it and get this treatment going, and then you have less time that you have to suffer and then less of a chance that you'll get that suffering after it's cleared up, which typically takes 3 to 5 weeks.
Yes, and Dr. Quinn, like you mentioned, what are some of those warning signs that people shouldn't ignore?
Basically, when you get that rash on the skin or you get that pain to the skin, go get it checked out, because if it's not shingles, it might be something else. And as we talk about on Live at 9, the health segment, if it ain't right, go check it out. Just listen to your body.